we tend to want to sometimes avoid medical care, right? We're like, oh, well, we can just keep them home and watch them ourselves, or we can do things that ourselves because we're doctors, as opposed to handing it off to somebody else and saying, no, I just want to be a mom.
Welcome to the Lifestyle MD podcast, a podcast dedicated to high-achieving women who are conquering their careers while striving for total wellness. I am Dr. Angela Andrews, and I am thrilled to be your guide on this journey. Hello, this is Dr. Angela. Welcome to the Lifestyle MD. I am so excited for this episode. We have Dr. Michelle Haggerty back from the Fourth Trimester Doc. Go ahead and say hi to our listeners.
Hello. So glad to be here again. Thank you so much.
Yes. This has been a long time coming. We talked about having this episode, or at least having a follow-on episode. There was a lot of really important data came out of our first talk. You shared some really important facts. I want to prep our listeners for what we're talking about by sharing a couple of statistics, and then we can jump into the details of that topic. Is that okay?
Love it. Yes.
All right. So first of all, female physicians die at a 2.5 time rate compared to the general population by suicide. And that is compared to our male counterparts. So male physicians die from suicide at 1.5 times the rate. And then when we look at breastfeeding rates, resident physicians are more likely to discontinue breastfeeding much sooner than their original plans compared to their female physician counterparts. And then overall, physicians just discontinue breastfeeding earlier than planned compared to the general population. And I can certainly attest to that. I was very frustrated with having to discontinue early because my supply is gone, just absolutely gone, despite all the effort put in to try to maintain it. But and then the other statistic that really caught me off guard big time is that residents have very high rates of postpartum depression. Again, I'm not surprised to hear this. 40% compared to 11% in the general population. That's crazy. So you work with moms, you see the good, the bad, and the ugly. So this is obviously something that you're very passionate about. And I'm wondering, is this kind of data, is this what got you excited? Is this something that really motivated you to start your business and start your practice?
Yeah, absolutely. I think that there's so many things that happen postpartum that is just not addressed, not acknowledged, not supported in the general, healthcare system. And we didn't even talk about really just in general, the overall statistic that the U.S. has the highest maternal mortality rate among developed countries, right? So that's
oh yes,
it's a horrible statistic. And then on top of that, 65% of maternal deaths happen postpartum. 65%. So and I think we might have talked a little bit about that in our last episode, but I just really need to emphasize that, we have 10 plus visits during the pregnancy. We have 24/7 care during the birth. And we're so focused on making sure that people survive through all of that. But then postpartum, you have the one visit at the 6-week mark. And then that's it, right? And that's if people show up to that visit in the first place, right? Or really get any of their needs addressed at that point. Like, their mental health is they're either struggling or they're not really at that point, or they're either, they're breastfeeding and that's working or they're not. And it's too late, really. It's too late for a lot of that. And then on top of it, it's also too early in that it doesn't continue to provide that care long term. So people, it's up to a year postpartum that those deaths happen. So we're not addressing and acknowledging the fact that there is significant need and need for support in that full first year postpartum, and not just at that one 6-week visit. So yeah, there's a huge need there. And then on top of it, right, I was seeing my colleagues really struggling in residency and as an attending as well. And that's just the general population. And now we have even higher risks and more struggle in our profession. So how do we best support our colleagues who are caring for others in this space? Right. So if they're the ones caring for other people, and they're not getting the support they need themselves, how do we expect anything to happen in the whole healthcare system that is really supportive of folks during that postpartum time? So there's a lot of work that needs to be done. Yeah.
And that, as you were talking, I was thinking, there was probably a time in our history where moms had a lot more support postpartum, and it went well beyond the first 2 weeks when everyone was around, right? It extended into that full year where you had extended family and moms and aunts and whatnot who were there to help support. And now where our families are separated and people are, have these professional lives and they're very isolated, we lack a lot of that community. And I talk with Dr. Carey, who is my naturopath colleague, and talk about how one of the pillars of well-being is community. And that's the piece. That's a big piece of this too, right?
It's huge. It's such a huge piece. And that's actually one of the things I hear the most is the feeling of isolation, feeling of loneliness postpartum. And we shouldn't be feeling that way. Like we deserve to have this team of people surrounding us that really, this village, right, that we used to have, of people supporting and caring and holding and carrying us through. It shouldn't be that you're trying to figure out on your own with Google, right? Like that's what people are doing in the middle of the night. It's just spending their evenings with Google trying to figure out. And that's not, or social media, which can be sort of a blessing and a curse because there is some connection that people get on social media, but there's also a lot of toxicity, a lot of mom shaming, a lot of things that come up on there that really sort of cause people to spiral. And so that individualized support for people as they're going through their unique journey is really important.
Yeah, that's fantastic. First of all, I'm so excited and happy that you are doing this and looking forward to sharing toward the end how you've expanded, which is exciting news. Yeah. That means there's going to be more opportunities for more women to benefit and more moms and more who have just really need this support. Now, we were going to talk about postpartum planning. Again, this is novel to me, a lot of our listeners. What is postpartum planning and how do you apply that to physicians? And do you think of it differently for physicians than you do for non-physician clients?
Yeah, absolutely. So I think to start off is, I say quite frequently that this planning for the birth and not postpartum is like planning for a wedding and not the marriage. So you're planning for the events, the big events, but like the meat and
that's genius, by the way.
Stuff, right? Is the postpartum time. It's the marriage is actually being like, it's all the stuff that happens after, right? And that is such a significant thing that we're missing that, people are so focused on that big event. And there's frankly, a lot of lack of control in that space. There's way more that we can do postpartum that we can have more control over and really have a significant impact on if we really just take the time to set that up. So yes, absolutely. I think it's really, really critical. And then as for physicians specifically, I do think that there's a little bit different of an emphasis that I specifically talk about with my physician patients in that I think that there's sort of this level of how do we ask for support? We have a hard time as physicians for asking for support from others. We have this very type A personality where we want to sort of have that control or have this look of being in control, even if we're not, right? So we look like we're in control, but we, things are on the inside are sort of spiraling. Right. And it's very hard as well to ask for support from people that see you as sort of the referral source or the boss or whatever. So for example, like asking support from a lactation consultant who usually refers to you to be the expert, right? Or from a nutritionist or from physical therapist or something that, that where they're referring to you for having the diagnosis and things, right? Then it can be hard to ask for that from somebody else who maybe is not in, your sort of field and doesn't really understand our mentality.
And you're also never really treated like a parent. You're never treated like the patient. Yeah. You're always a physician.
Right.
Like even to your colleagues.
Completely. And so there's this feeling like you should know. So the way that people talk to us, it can be very medicalized and not sort of like, even if like, let's say you're a nephrologist and you're not a pediatrician, but they're talking to you about like, you should just know these things that are, happening to your kid. Or even as a pediatrician, the other side of things, I think that is not well recognized unless you're going through it yourself is that the physician mom brain is very different from the physician brain, right? The clinician brain. And they don't play well together.
They don't.
It short circuits, there's hardwiring and stuff that happens. There's all kinds of stuff that's just is so off that, we think about the zebras, the case that we saw 20 years ago, the really scary stuff when it could just be a cold and some snot, it's like
this is really touching home.
Right. Exactly. So we go into like we ruminate then. And so it's very, very hard to differentiate between the mom brain who's trying to be like the sort of mama bear, like protection, the one that's trying to think of all the things and make sure that they're doing everything that they can for their baby. And the clinician brain that like is, has all the knowledge base, but then is now like making this sort of short circuit. That's something that I work a lot with people on how do they hone into their intuition and not into the crazy, right? Not into the stuff that like is, sort of happening, up in the cerebral stuff, right? And trying to come back in and what is really happening here? What are we really seeing? And also like that they don't have to doctor their own kids. So that's the other thing too, is that we tend to want to sometimes avoid medical care, right? We're like, oh, well, we can just keep them home and watch them ourselves, or we can do things that ourselves because we're doctors, as opposed to handing it off to somebody else and saying, no, I just want to be a mom. Like, I just want to be the parent, and I don't want to do any of the medical stuff. And I want you to take that over. So that's one of the first things I say to people is, I've got this. You don't have to do any of this. Like I'm taking this from you. And so you get to be mom, and you get to enjoy that piece of things and all that stuff that goes along with it, because it's challenging. That's challenging enough in itself. But let me take this. Let me take that off of you. Let me take that. And I see people just do this.
I was just going to ask you, do you get that like exhale, that drop in the shoulders, just a clear visual sign of relief?
Complete relief. And then it's just like, wow, okay, now I can ask the questions. I can release some of this. I can be vulnerable, right? Because now I don't have to be the one doing all the things. I don't have to be the doctor and the mom and the, and the, right? Just get to, which momming is enough. Parenting is enough, right? Like that is work. And I don't want you to be doing anything of extra stuff. And in fact, it just makes things more sort of messed up because, you're sort of thinking through things in a different way that doesn't make sense really, because our brains don't really work that way in that space.
That makes a lot of sense. So you mentioned when we were talking about some of the statistics that postpartum deaths goes out to a year. So when we're talking about postpartum planning, is this 12 months after? Like, what does that typically look like?
Yeah. So I start with really the fourth trimester. So that first 3 months, I think it's really honestly, the first 2 weeks is the really critical stuff, the really critical transition of really getting things sort of on board. But yeah, I mean, it goes out to a year on just thinking through, what is going back to work going to look like? What is being back at work going to look like? So there's a transition of preparing to go back to work. And then there's also being back at work and what that, and what's your support systems there. There's a lot of things that happen in that first year. So we really want to acknowledge, what all those sort of steps along the way. For the majority of deaths come from homicide and suicide, mental health stuff, basically. So that is the sort of challenge, is really acknowledging because that doesn't necessarily always show up in those first couple months. So knowing that they have that support system down the line, like make sure you have a therapist, make sure that if you're on medication, you have somebody that you're going to be, following up with, making sure that they know that they have support systems in place that they can come back to. And for me, I'm with them forever. Like I'm with you all the way. Like you are whatever, even though we've maybe stopped our visits around 3 months or so, I'm sort of like they graduated on and they're now seeing their pediatrician and things. Anything that comes up, you come back to me. Like I'm here for you. I'm a text message away. We've got you, because again, it comes back to that loneliness piece. I don't ever want anybody to feel alone and that they're not being held and carried through this sort of transition, which is huge in the first year.
That is huge. So if you're primarily focusing, if the main bulk of your attention is in that fourth trimester, it sounds like what you are also then focusing on is helping line people up with additional support, because they're going to need support kind of ongoing. Because if they start having more signs of depression, are you also helping some of those support people around them identify those clues? Are you empowering other folks as well and helping them to identify it?
Yeah, absolutely. And I think the other piece of it is the other piece we need to think about is the partner or paternal postpartum depression and anxiety, which doesn't typically present until closer to 6 months. And so really it's about, and then I talk about like, what are those signs and symptoms, which are different from what we classically think of as sort of the postpartum depression.
So what are those signs? I'm ignorant about this.
Yeah. So a lot of things I see are rage is one, like sort of pulling away. So doing extra work trips when usually they don't usually do work trips, or spending a lot of time with friends or other people as opposed to the family, sort of trying to get away from the nuclear family. Sleeping a lot more. So spending a lot of time in bed, or again, sort of like that pulling away. And then being very immersed in work. So where they're like working super long hours when they didn't do that before. Those are typically what I've been seeing lately, it seems like. But yeah, it's not the the classical just look depressed. They don't look like necessarily, they're sort of functioning, right? They're functioning, they're working, they're doing all the things, but they're they're sort of pulling away from the baby and the family, not bonding very well with the baby, doing a lot of like stuff away from, not really wanting to hold the baby, not really wanting to be involved in that stuff. So
it sounds a lot like elements of postpartum depression in the mom, right? Where there's that withdrawal.
Withdrawal, yeah, it's definitely withdrawal, right?
Okay.
But it looks different. It looks different.
Okay.
I think because the withdrawal in the birthing parent is sort of this like almost emotional withdrawal or like the bonding withdrawal, but not like a physical withdrawal, right? So like they're not like away from the home, right? They're not like away. It's trying to away from everything. It's almost like they're still present because they're there, right? And they're still caring for the baby and doing the things, but maybe not doing it as well. But they're at least in the physical vicinity.
Kind of like executing and carrying out, doing the movements, going through the motions.
Right? Exactly, going through the motions of the day, but just not really being sort of mentally.
And it kind of looks, and that makes sense. I can visualize how that would look different.
Yeah. Exactly.
Wow.
Yeah.
Is there, and I don't know if you have the answer to this, but are the triggers the same? Like, are there pre-existing underlying risk for depression or anxiety, or is there something about just the newness of this relationship and what is it about that precipitates the paternal partner? Yeah.
Multifactorial, of course. Like there's all these different things that kind of happen, but I think part of it is the sort of shift in stress hormones and things like that, right? So they have this like sort of surge initially in the first, several months postpartum where you're just having to do all the things, right? And everything's new and you're having to sort of be on, right, for everything. And then they go back to work, right? And then it's like, okay, so now you're in a work setting and now you're trying to navigate this home life and this work life. So how do you navigate that? And now you've also sort of lost your partner. So like your person is now somebody else's person. Like, so now they're like, where do they fit? And the baby is so reliant for the most part on the birthing parents, especially when it comes to breastfeeding or lactation, that like, what's their role? Like, what is, where do they fit into the family now when, there's this sort of very, very connected, dyad that's sort of there that hasn't been there before. Intimacy, right? So that's been significantly affected, right? Because now maybe there's not the feeling of being touched out or the feeling of, or maybe they had a traumatic birth, or maybe there's like a lot of pelvic floor issues or whatever, and you're not quite ready to, sort of have that sort of intimate relationship again. And so how does that look? And maybe that shifted, right? So like, what does intimacy look like? And maybe it doesn't necessarily mean penis and vagina sex, but maybe it means some other forms of, intimacy that doesn't, was different from what it was before. And so there's a lot of shifts that happen in what their life was and now is. And so how do they sort of navigate that? I definitely think that there is, there's, if they have a history of depression or anxiety or issues with anger management or things like that, definitely will come up, right? Because now, and lack of sleep, of course, right? Like that's a huge, right?
Let's not forget that part. I've only been talking about sleep like a crazy amount on my social media. Right? Let's not forget that.
Like that's just a little, is massive for so many people, right? And maybe they used to work out a lot and now they're not doing that as much anymore. Or maybe they're not spending time with friends and their community that they're their outlets before. So how do you continue having an outlet?
And maybe you're not happy. You haven't had date nights.
Exactly. Right.
Oh my gosh.
All the things, all of it. Because the world just shifts, right? Everything just
this just really like struck me. Like our youngest is 6. He'll be 7 next month or in 2 months. And I'm thinking, wow, I never really thought about, I thought about all the impact on me, but wow, it impacts your partner too.
Huge, right? Yes.
Oh.
Depending on the relationship, maybe they're doing a lot of caring for you because you're sort of recovering postpartum, and then who's caring for them, right?
For them.
And there's birth trauma that happens in the partner as well. So they witness their person again going through, huge, like this huge traumatic event, right? And sometimes there can be on the brink of, death for some women as they're going through their birth. So now you're watching your partner go through this experience, and you think, oh my gosh, I'm going to lose them, right? And so now, what is that? So then they have some PTSD stuff coming up sort of later on. So it's all of these things that isn't addressed, right? Because everyone's so focused on the birthing person, which
Right.
It needs a lot of support, but also there's, this other half, which is where family medicine is just so critical, right? Like, it's just like the whole family and the whole,
Exactly.
everyone plays a role and everyone is important, and it needs to be acknowledged and addressed and supported in how all these shifts are happening. Because then everyone thrives, right?
Right. Oh my gosh. And that's not even talking about who don't have partners in the picture.
Right. Yes.
And I mean, that's a whole nother collection of challenges. We could go on about that for days.
Completely.
So you navigate this in fourth trimester, doc. How can other doctors, or how can other care providers, how can just anyone that's in their sphere help with this transition? Because this is really a whole nother transition. Well, we talked about matrescence too, but that's going to be a whole nother episode. We still need to do that one as well.
Right. Yes.
I'm still excited about that.
Right. Yes. Yeah.
So,
we need to dive into that.
How do we support? How can other folks get, step in? Because clearly it can't just be you, right? There's got to be other people.
Yeah, absolutely. So I think it comes from, the communities, from the healthcare community, the physicians and midwives and things that are caring for folks during the pregnancy and the birth. They can start by helping prepare them for postpartum. So you can start by having those discussions on what are the things that are necessary and important to support, that people can get set up for a successful postpartum period. So I think that's really important. And we can kind of go into that a bit in a minute here. The other thing I think is, as a community, as sort of friends and family and neighbors and things like that, if you're not necessarily part of the care team, is we can support people in their postpartum. So for the very first thing I talk to people about is setting up, their support system and people that you want to have people surrounding you that bring in energy. So we have people in our lives that are energy givers, and we have people in our lives that are like sort of energy suckers or energy takers. And we love them all. They're all part of our severe, and they're all part of our, but they all have roles, right? And in the first couple of weeks, and even up to a month postpartum, you want the people that come into your home to be the energy givers. They're the people that are sort of acknowledge what needs to be done. Oh, I see dishes in the sink, I'm going to do them. You don't need to ask. I see that, there's laundry in the basket, I'm going to fold it. I see that I'm going to bring food. I'm going to bring nurturing food for you. And I'm going to acknowledge, what.
And I'm not going to ask. I'm just going to do it.
I'm just going to do it, right? And I'm going to sit with you, and I'm going to hold space with you, and I'm going to let you cry and tell your story, and get things out, and just be there, right? And just be there to support you and whatever you need, and not sort of dump all my stuff onto you, right? And I'm not going to ask to hold the baby, right? Like, if you want me to, I will be here to do that, because then you can go and take a nap, or you can take a bath or whatever. But it's not.
Can we rent these people?
Right, exactly. Yes. Doulas.
There you go. Right. Yes, the doulas.
Yes, you can. They're trained to do this. Yes.
Amazing.
So it's that type of stuff, right? But and then the energy takers are the ones that, sort of come in and expect to be hosted, right? They're the ones that like sit on the couch and ask for some tea and want to be fed, and like they don't bring anything into the home, and in fact take energy away, and they sort of complain, and they, you don't feel comfortable nursing or breastfeeding around them, so they make you leave the room, like all of that type of stuff, which is they're only there to hold the baby, right? They don't want anything else. And those are the people that you just don't want there in the first month, couple weeks, because they're not the healers. They're not the support system that you need at that point. You want those people to be the ones that are, come over later. And, when you're sort of functioning more and you're able to.
So are you having folks identify these people ahead of time? Kind of like, hey, let's come up with your list.
Right. And as soon as I talk about it, you're like, people are like, oh, and they just, you can tell their list like in 30 seconds.
Yeah.
And sometimes it's in-laws, honestly. Like it can be the parents, the grandparents, the in-laws. And then if they're coming from out of town or another country and they're coming to visit and they're going to come stay with you, we talk about so is it best for them to actually stay in the home, or maybe it's best that they stay in the hotel down the street, so then they come in and they can leave, and they can come in and they can leave, right? And so you can set up those boundaries and set up the expectations in advance, so that then again, everyone's better off because of it, right? But
this is so much deeper than I could have ever imagined.
Exactly. And that's the thing, like there is so much to it that I think we really could go really in depth with a lot of different aspects of it, because there's so many different pieces that really that can affect that postpartum period. And it's so unique to each individual, right? And each individual and the family and the community that surrounds them too.
Wow.
So postpartum doulas, fabulous because you rent them, you pay for them. They'll come in and they'll do all those things. They'll make meals for you. They'll take care of the older kid. They'll intuitively done. They'll do all the things, right? So I love them. And I think they're a really great part of that community of support.
But as soon as you mentioned that, you mentioned how like, individuals will kind of know right off the top of their head. I mean, as you started talking, immediately I said, oh my gosh, yeah, my mom. Yeah. My mom, like she walks in, it's like dishes, like she's always doing stuff. Don't even have to ask. I'm like, yes, my mom would need to come see me.
Right. Because they do. And when they leave, you're like, when can they come back?
Yes.
Like, oh, that felt good for them to be here. Oh, that just felt really nurturing and loving and supportive, and it's good. It's all the goodness.
Right.
And when other folks leave, they're just like, it feels like it just kind of sucks stuff energy out. And you're like, oh, we could do away with, I could do a couple.
So what if someone says they don't have any energy givers that they can think of? What do you do then?
I honestly think everyone has somebody in their circle. I think that there's a neighbor, maybe somebody that's not super close, but maybe has that energy. They're like, oh yeah. We don't hang out a lot, but they definitely, and then how do you ask? Then it's about how do you ask for something from somebody that maybe you're not used to asking that from, and putting yourself out there and being vulnerable and being able to do that. Maybe you absolutely don't have anybody. And then there's maybe like I said, a postpartum doula would be somebody to have come in, or lactation consultant who kind of has that energy as well. Body workers, massage therapists, acupuncturists, those types of folks tend to have that sort of energy. So they're the ones that can sort of provide that for you too. Some healing hands. Having massage postpartum is amazing because it really can release some.
I never thought of that either. That's so sad. Can I have a redo?
Right. It can be so So I recommend people telling the birth story while they're getting a massage, like saying it out loud. And what's so incredible about that is your body holds the story. Right? It holds the history of whatever that was. And so you can have like a little bit of back pain or a little bit of, tension in your hip or whatever. And as that massage therapist is working in that spot and you're telling your story, and maybe you get to a little bit of a tender point in your birth story, you release it, and that releases from your body and it releases from your soul, right? Like it's just like,
Oh, that totally makes sense. Well, and that reminds me of a book that I really love, When the Body Says No. I think that's a pretty popular book now too. And it's kind of the same concept, right? Well, not even kind of, it is.
It is. It's exactly it. Yes. Yeah.
Oh my goodness. So what are some of the other key things that you focus in on in that pre and postpartum period?
Totally. So I have 5 pillars that I talk about. The first is nutrition. So of course we need really, really good. And you can talk again a million years about nutrition, but really hearty, warm, easily digestible foods. So you think like stews and casseroles and things that are sort of warm and mushy. So your body, so like a big salad is not what we want to do right away postpartum. Yes, that's healthy for you in general, but not postpartum. We want to make it easy for your intestines to break things down. We want everything to be really easily absorbed, and we want to keep that body nice and toasty warm. So we want to do things like soups and congees and things like that are very highly nourishing, but also like that warm and easily absorbed nutrients. A lot of variety, right? A lot of the whole rainbow, lots of vegetables and meats. If you eat meats, salmon with the good omega-3s, right? So the healthy fats, and then bone broth can be really lovely as helping with that collagen and a lot of those nutrients. I personally love a breakfast congee. I think like with oatmeal and you can even use like different grains like barley, quinoa, kind of do a mixture, put some warm berries on top with a little bit of some cream or some milk and a little bit of maple syrup. And it's just lovely. Oh. It's just like this incredible,
so good.
Incredible meal to have for breakfast. And then lots of snacks around, right? So a lot of high protein things. I really like granola or I actually make granola for my patients and bring that into the home for them. But yeah, so like with nuts and seeds and things like that are really to sort of stick with you for a longer period and don't have those spikes and, sugar spikes, and thinking through that. And then, so you can set up things like a meal train. So you can tell people in advance, like, these are the days that you could drop off a meal. And then I have people put a cooler out front on their front doorstep so that people don't even need to come in. Like, you don't need those energy takers in your
awesome.
Drop it off on the front cooler, send a little text message. It works great. It works great for people that are making making the meals and the people that are receiving them, because not everyone just wants to be visiting. They just want to be able to just support and sort of move on with their day and things. So so that's nice and easy. And yeah, there's some really great cookbooks and things out there that have some really lovely recipes. The first 40 days is one of my favorites that have a ton of recipes that are great for postpartum. Some communities actually have meal delivery services that are specific for postpartum, but otherwise just in general, meal delivery services are great. Doing like delivery services from the grocery store, like trying to avoid having to go out is, so awesome. So there's a lot of different support. And then I have people, one of my favorite things is having whatever their favorite restaurants are around, printing off those menus and highlighting their favorite meals from those menus. So that then it keeps the decision-making fatigue down, right? You just say, hey, I want something from that Indian restaurant, or I want something from that Mexican restaurant. And then either the partner or family member or whoever can just order whatever that highlighted thing is on the menu, and you already know you like it and it's great, and it just comes and you don't need to think about it any further than that.
I'm going to add that just now. I mean, I think that's just a good tip in general.
Right, just to have. Yeah, exactly. You already know what you like, so you might as well just order it.
That's fantastic.
Yeah, totally. So yeah, nutrition, I think, and then obviously, staying well hydrated. So lots of fluids, electrolytes, things like that, sort of keep you hydrated. And we can, I could even go like really in depth with you think specific nutrients, magnesium, vitamin D, choline. These are all things that we really.
Are you recommending supplements, or kind of like helping encourage a variety of whole foods to do that?
Both, actually. Supplements, I do recommend vitamin D supplements, magnesium supplements, keeping with either a postnatal or prenatal vitamin postpartum, just to keep those things up a little bit. But, really, we want to try and be getting most of it from the food in general. So
that makes a lot of sense.
Yeah, absolutely.
All right, what's the next pillar?
Yeah, the next pillar. So I talk about physical recovery. So, the pelvic floor, movement, right? How do we sort of support that physical movement in that postpartum period? I really like to go by the 5-5-5 guide. So it's 5 days in the bed after the birth, 5 days around the bed, and then 5 days around the house, and then 5 days around the neighborhood.
Where are you at?
I know. And this is critical for physicians because we have a hard time sitting.
Yeah.
Right. Right. So what helps with this, for the most part, for a lot of people is, thinking about so our bodies are recovering. So we shouldn't be going to target at day 3 postpartum, right? We should be, right? Yeah. Exactly. How many people do that? I know.
What are you talking about?
Right. No, well, who does it? I didn't do that.
No.
But we want to be sort of, recovering. And part of that is bonding with that baby and the breastfeeding and getting that lactation stuff set up. And we need to be home doing that, right? And resting. And so it's really this very slow process of, sort of starting in the bed and then moving a little bit further and moving a little bit further. And so, and when I say around the neighborhood, I mean, just 2 doors down, walking, a little walk. And then
right.
We let our bodies guide us. So if your bleeding increases, then you've gone a little bit too far, and now you come back to that last step, and you sort of stay in the last step for another day or two, and then go back up, take the next step again. But I think what helps for a lot of people to think about is that you're not only recovering, but your baby is being acclimated to the world and being introduced to the world. So their nervous system to slowly be introduced to the world as well, right? So going to Target with the fluorescent lights and people and all the things is not helpful for them, right? So if we're starting in the bed and they're getting used to your body and your smell and what happens around the bed, and then they're getting used to sort of the room where you're up in a rocking chair and kind of moving around there. And they're getting used to the kitchen and the household and new signs or new things to see and smell and hear, right? If there's a dog or whatever, other things moving around, they're just sort of slowly being introduced to the next step of your world, right? And so it just helps them make that transition so much more smoothly than this very jarring. They came from this tiny,
So as you're saying this, I'm counting the days. That's 20 days, right?
Right.
Okay. And I remember physicians coming back after 2 weeks.
Right. Yes. To work. Right.
To work.
Yeah.
Skip that whole process. I mean, because you had to be doing that puts that in context.
Well, and we also we ask babies, as pediatricians in the healthcare system, we say, we need to see babies at 3 days postpartum, or we need to see babies at 5 days postpartum, or we need to see, and again at 1 week and 2 weeks. And that's, again, interrupting that whole thing, right?
Right.
Again, we're coming into a space with fluorescent lighting and lots of people and all the things and all, so yeah.
All the more reason those visits should be at home.
Yes, exactly. Exactly. As far as like the physical recovery stuff, so thinking about the pelvic floor, how do we support there's a tear, how do we support the pelvic floor in recovery? Again, back to the body massage, things like that, just sort of help with allowing that body to recover and what that all looks like. And then the third thing I talk about is the mental health aspect. And so, we talked a little bit about that as far as making sure if you have a therapist, having them on hand, like, hey, I'm giving birth in a couple weeks, like just letting you know, like, maybe we should put an appointment, a virtual appointment to kind of just check in, all the things around like sleep, especially. So how do we encourage adequate sleep for both partners if there is a partner involved as well? So I really encourage people to get 4 hours, like 4.5 hour stretch of uninterrupted sleep. That means that the partner is on for that time frame or the support person is on for that time frame and nobody interrupts you. You are down from down, eye mask, earplugs, in a different room, sleeping. If you can protect 4 hours every 24-hour period for each person, it's life-changing as far as being able to, because it's a full sleep cycle. You feel like you're rested. You don't feel like you're sort of moving around zombie land, as opposed to both people waking up every 2 to 2.5 hours or 3 hours, whatever it is. That's just sort of, around the clock. So
kind of speaking along those terms. So when you're breastfeeding and baby is sleeping in the room, I mean, that can be disruptive for both partners, right? Potentially. Not every partner wakes up, but what do you recommend in those situations? Would you encourage maybe separating into different rooms to protect the sleep of one person?
For that 4-hour stretch, I definitely recommend either having the partner take the baby in a different room and caring for them in a different room, or just going and sleeping in like a guest room or on the couch or someplace that's away from where that baby's sleeping. I actually have the partner sleep. So if the crib is on, one side of the bed, I have the partner sleep next to the baby on that side of the bed, and then the birthing person on the other side, because our sense of hearing is just like so amplified.
That's true.
So every little or like breathing differently or the kicks or whatever, and all of a sudden we're awake, right?
Yes.
And so if you separate it a bit, then it allows for the baby actually to legitimately wake up, and then you're sort of waking up after that. So it gives a little bit of that space, so you're not hearing all the little teeny things that just make.
I swear, all these little nuggets are like revolutionary.
It really makes a difference.
How come this isn't just common knowledge? This is golden.
We don't go through it, right? And by the time we go through it, we're in the midst of it, so we can't think of these things, right? And so we are so in the thick of it. So if we're not planning in advance to prepare for this time and be ready for it, our brains and our capacity to be able to come up with problem solving and solutions is out the window. Like we can't do it at that point. So it does seem intuitive when you're talking about it, but it really needs to be a very intentional thought process and planning, so that then you have these resources and these sort of tips and things that you can go to easily.
You got your map already there.
Exactly. Right.
So you don't have to think about it as you're driving, so to speak. You can just execute, turn right here.
Right. Exactly. So it's a huge thing. I think all the little things, and that's when people are connecting with me, and when I'm working with them postpartum, I can ask these very little, like, how are you sleeping? Where is everyone sleeping? What is that looking like? Especially when I'm in the home, I can walk in and I can see exactly what the setup is. And then we can make those adjustments that sort of fit with that. And then sleeping, I think one of the critical things I think that is so important about talking about sleep is co-sleeping, legitimately bed sharing, because 85% of people will bed share at some point, even if they don't plan on it. So the not planning is the dangerous part, because if you don't plan, then you set yourself up in a bed that is not ready for it. Or people are so avoiding the bed and they're so exhausted that they're sleeping in a reclining chair, or they're sleeping on the couch, or they're sleeping somewhere else that's completely super, super dangerous compared to the bed. So let's talk about how do we prepare the bed, so when it happens that you are so exhausted and baby's so fussy and you just need to lay down, how does that look? And what do we do to sort of prep for that? So there's something called the Safe Sleep 7 that talks through how do you prepare a bed for the safest way possible to have a baby in the bed with you. Or I also recommend taking the mattress out of the crib, putting it on the floor, having the baby lay on the mattress on the floor, you kind of wrapping yourself around it, no blankets, no pillows, nothing. And then when you fall asleep, you can roll over away from the crib mattress, and the baby's just laying on the crib mattress then, and there's sort of its own space. So there's ways of doing it that are safer than being like falling asleep on the rocking chair with, the baby on your chest or whatever, which is what most people will end up doing. It's similar to me as like abstinence at only sex education. Like, you can't be so strict about something saying never, 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 because when it happens, then it's not safe, right? Then you're not using protection. You don't know what to do and you're stuck. So let's talk about how to, again, plan. So if and when that happens, you are in the best case scenario and the best safe scenario for both you and your baby. So then you can sort of survive and then figure out what the next steps are and how do you get the support you need to make sure you're getting better sleep or whatever it is.
Oh, that's great. I love that you touched on that, because I think that's a statistic that people don't often think about. The actual how many people actually end up co-sleeping unintentionally.
Exactly.
It happens.
People don't talk about it. Then they don't come and they don't tell their pediatrician, like they're asking, where's the baby sleep? Well, most of the time it sleeps in the crib, but like when those times come when they're fussy or colicky or whatever, and what happens then, and then people don't talk about it, so they don't get the support and the guidance on how to do it as safely as possible.
And how to navigate that. That's awesome. Exactly. What was that again that you refer to? Safe Sleep 7?
7. Yeah. The Late J League is the ones that came up the guidance around that. And it has to do with like, if you are, you want to be breastfeeding and not formula feeding, you want to be, there's no pillows and blankets around, no alcohol, no drugs, no smoking. What else? Babies lay on their backs, so they're not on their tummies, and no soft sleep surface. So it's got to be a firm surface, which is why I think the floor can be a great place. So those are some of the guidelines around that. But it's, I think it's really critical to sort of be aware of and set it up for a good.
That's really great. Thank you for sharing that.
Yeah, absolutely.
Is there anything else around mental health that helps folks?
Being integrative medicine, I use like herbs and supplements and things like acupuncture. And what I think is so critical is that the only thing that's going to help people is a thing that resonates with them. So if it feels like medication feels like it's going to resonate with them, great, let's use the meds. But if they're like, no way is meds going to help me, there's no way they're going to take it appropriately or take it regularly. And if they resonate better with energy medicine, for example, then Reiki is going to be the way to go, right? So again, it comes back to that unique, the person that's in front of you. How do we treat this person in front of us to best support them so that then they have the best option to be able to thrive in whatever situation that they're sort of dealing with? And so I think that's critical as far as like, when we're dealing with mental health, like how do we approach people and then how do we meet them where they're at and what modalities work best for them?
That makes sense.
Really, really important. And then, so what are we at? So nutrition, we talked about sleep recovery, mental health, the support system. So we're back to like the tribe, right? So the people that you want in your corner. And so that's the other piece that the other sort of pillar of this is the support people and getting lactation consultants or breastfeeding and lactation medicine specialists. If you're planning on breastfeeding, having their numbers and everything available, ready to go, so you know who to contact. The mental health stuff, if you use acupuncture, having acupuncturists available, like I said, massage therapists, if you're having friends or family coming in and dropping food off or whatever it is. So thinking through all the people that could be supportive for you and how do you reach out to them and how does that sort of all look? So that's the visitor part and the support system and the tribe. And then the final thing is your environment. We want to set our environment up for healing and for a space of goodness. And so I don't know if you're familiar with the term hygge, so it's hygge,
no.
But it's a Danish term for coziness. So it's everything you think of that's cozy. So like a warm fireplace or like soft socks and a big snuggly blanket and silky pajamas and, like whatever it is, and all the warm, nourishing foods and the teas and the smells like candles. And so when you're setting up your postpartum environment, I like to call it my postpartum sanctuary. So you're coming into this space where you're going to be spending a lot of time, 20 days, right? Like it's a lot of time. And so how do you set up this space to feel really good and really yummy, right? And so like that is like bringing in plants, bringing in nature, bringing in, even if it's pictures of plants and nature, that's totally fine. Bringing in pictures of your favorite vacation, or like if you have older children, like they're coloring and they're like little drawings and things, like having that around, having photos of your family and friends everywhere. Like we're talking about revamping your bedroom. room, right? And then having, snuggly socks and nice smells, things like whether it be candles or whatever that's sort of available, whether you use aromatherapy, maybe having, are you going to be watching TV? Is it something that, so you want to set up where's the TV sitting, and are you going to be watching like shows? So maybe set those up in Netflix or Hulu or whatever, and have everything like sort of ready to, like you can add favorite lists, right? So again, taking away that decision fatigue. You want to be watching shows that are like 20 minutes, 25 minutes, like the sitcom kind of stuff. I really love Schitt's Creek. I think it's like, it's perfect. You laugh a little bit. You're not like feeling like you're on a cliffhanger. I do not recommend things like a Game of Thrones, for example.
No.
You want, right? But it's like, but when you're scrolling, you want to be able to like just do something really quickly. Friends, like the Seinfeld, whatever, something that like gives you a little bit of a giggle and a laugh, and then you can fall back asleep again right afterwards as you're nursing. And then, or maybe you do audiobooks. And so like you have all that set up, or maybe you do podcasts or
podcast.
Right? Yeah, exactly.
Right.
Right. Have this.
Maybe you're listening to this one.
Right. Have this on repeat. So, download the podcast and be ready for that. So you can just sit there and have just this nice little space. People always buy babies like these really soft little blankets, which are so sweet. But I recommend buying for yourself or having on your registry or whatever, a huge, super snuggly blanket for you. This is your postpartum blanket. This is
That's a great idea.
Your snuggle blanket. And what's really cool about it is that you have this very special tactile thing that you have during this time that just keeps you nice and snugly warm. And then you can continue to use it. And so, for example, my kids use their own individual postpartum blankets in their beds now. Like this, it's their blanket.
I was just imagining that. Then that can become your kids' blanket when they're ready for a bigger one.
Exactly.
I just absolutely love that. Oh, my goodness.
Talk about it. They thought, this is your blanket. No, it's my blanket. No, and now you get to snuggle with them when you're putting them to bed with this like blanket that was so special during that really early time, and just bring back those memories. You want to be bringing back the goodness, the good memories, the good feelings that happen postpartum. It doesn't have to be this scary, awful thing. It can be just, this really snuggly, beautiful, yummy space that, if we set it up right, can be really lovely. So so that's sort of the overall, but we can go into depth with any of them, but it's, I think there is so much to be said about. There's so much to go into on how do we prep for this time that can be really just so rich. And so, provide so much guidance for people that they don't have to go in just sort of like, trying to figure it all out.
I mean, and you've just given us essentially just a real sneak peek at, talked about these pillars, and imagine having all of that support during that fourth trimester and what that would feel like and look like. I mean, just a little bit that we talked about, a lot of it is things I would have never, even now, would not have considered or thought of. And I'm looking forward to sharing some of this going forward with friends, family, and patients. But even more importantly, how do people find you? And how do people find people like you? Because I know you're not here. Well, in Michigan, speaking of, I'm in Michigan. You're Minnesota?
Minnesota, yeah.
Yes.
Yep.
So doulas, we know that doulas exist. I mean, could someone get similar support?
They can get a lot of the support, like not the medical support, but like sort of the nutrition and social and like, physical kind of support from that aspect. And then also like they recognize when there's things like they can screen for like postpartum depression and anxiety, and they can sort of be, like sort of that stop for like helping with, finding referrals of who you need. Okay. Some of them have extra training in body work, so they can do some body work on you. Some of them have extra training in lactation, so they can help with that. They may not be a lactation consultant, but they may have like at least some basic training on how to get sort of good latch, right? But then they're also like connected with the community, the birthing community, on who to reach out with, or who to reach out for. So I think that they're a great resource. I can't say enough good things about having somebody like that in the home to support, for sure.
And I've got in my primary care practice, I have a couple of women who are in my practice who are doulas and have their own doula practice. And I've learned a lot from talking with them about their experiences. Interesting. I have a patient who's also interested in becoming a death doula, which is something
that's so cool. Right.
I know, isn't it?
Oh, needed. So needed.
So needed. Just learning from the unfortunate thing is not everyone has access, right? And so when you and I started talking offline, first of all, your practice, your reach is growing. You've added physicians to the practice. You said 4.
Yep,
New
feel forward
physicians
now.
have joined. Congratulations. That's fantastic.
Thank you. Yeah, it's really exciting.
It's so exciting. And first of all, that means that there's an interest and there's a need. We know that.
Yes.
And for more people to get it, you're kind of looking at some other avenues to increase access. And then I was thinking, okay, you mentioned earlier research. And as we were talking, I was wondering, okay, is there research to show that we can decrease these rates of the postpartum depression and suicide?
Yeah, not solid research as far as this postpartum support. There is some decent research internationally. So in Europe, for example, with some of their home visiting services and things that do help with maternal mental health. Not in the U.S. and not coming from the physician, physician support. I can say anecdotally, 100% it helps. I see it in my practice. Which is where I want to go next, is how do we, I want to develop some studies that really look at how do we look at this model and what true impact is. And then how do we then get payers to pay for it? Because commercial payers to insurance to really be able to or employers, for example. I think that's another avenue that can really be a huge aspect. If you get your employer to pay for some of these.
That's true, because that could be another benefit. It could be, you could have a postpartum benefit.
Exactly. And honestly, it's cheaper than, some of you get back to work. We can, again, the mental health side of things, the lactation, all these things. When things are going better postpartum, then it's so much easier to transition back into the workspace, and they have better retention, they have better ability to recruit people, families. So it's a huge benefit for employers to,
and not to mention the fact that it doesn't become one of those things where you're avoiding the conversation about, if I have children,
right.
Is my job protected, or can I have that conversation? Yeah. Wow. An employer who's having the forethought to say, hey, look, we know that this is important. We know this is challenging. Let us support you. You're already signaling to people that you're valued. And yes, having children and raising your family and being healthy through the process is a priority.
And it's important. It's important for our economy. It's important for, our
economy, our children, everybody.
Yep. Exactly. Everybody. Everybody wins when mothers or brothers thrive. So really, I think there's a lot of ways that we could then utilize this data to then support getting better support for more folks. If you're in Minnesota, we're all over the Twin Cities, and then also in Rochester, which is sort of near the Mayo campus. And then I'm also co-executive director and co-founder of a nonprofit called Center for Fourth Trimester Care. And we have a directory on our website that has physicians across the country who are doing similar work in various states. So that's another resource if you are looking for a physician who would come into your home and support you this way. We do have several physicians across the country that, and it's expanding. So more and more, we're trying to train and support more physicians in doing and being able to get out of the system and do this work that they love. Honestly, it's so, having long visits, being connected. This is why a lot of us went into medicine. And so it's a cure for burnout, honestly, for the physician side of things. I feel energized at the end of the day. I don't feel burnt out. I feel excited, and it's awesome. I love what I do.
I can so relate to that. And I'm so grateful that you answered the calling to pursue your passion, and that you are an example for so many other physicians out there, and especially women physicians. There's more than one way.
Yes. Right. There's definitely more. Yes.
So I so appreciate that. And, and I echo the sentiment of what we went into this for, being able to spend time and have relationships. When I'm talking with folks, I find myself just telling people who are interested in my practice, I love what I do in my primary care practice so much more now than I ever did. It has rejuvenated me to a level that I could not have predicted or imagined.
Yes. A big message, I think, just for physicians as a whole, we don't have to be stuck in the system. We can build what we dream, build what we want, build what we think that we would. If you want it for yourself, I guarantee there's other people that want that too. What does that look like? What could it be? And it's constantly trying to encourage people to just dream and then see what happens. I love it. Yeah.
Well, I am really hopeful that we can have another discussion about matrescence. We didn't talk about it all this time, but it came up in our first podcast episode, and I was very intrigued.
Yes.
So I want to know more about that. So I'll come with some questions ready for that one. Any final thoughts that you want to leave our listeners with?
Well, I think it comes down to, again, coming back to that planning aspect. Like, let's really prepare ourselves and our patients for success. And how do we do that? And even just giving, you don't have to give this whole talk that I just did right now, but even little nuggets of information or referring them to talks like this, important to just really transform that postpartum period. So it doesn't have to be so scary for folks. And it can be really a very lovely, wonderful transition time that can, that they're learning about this little one and expanding their family and learning more about themselves.
That's
and
so amazing.
And all the things. So it's amazing. It'd be really incredible.
Well, I think you hit the nail on the nose. One of the big reasons that I started this podcast is to share information that, wanted to share broadly and something I can refer people back to. Because there's things that we often talk about over and over again, or there's things that we want to expand upon. And there's just, even with long hour visits, there's just never enough time for everything. So I get to share this with people. You get to share this with people. We get to share this with so many other individuals. And so, yes, refer people back to podcast episodes like this. It's a great resource. And then I'm going to also make sure I reference the website again in this podcast episode in the notes so that people know how to find resources near them.
Awesome. Yeah, that'd be great.
Oh, awesome. Well, thank you again so much for joining me, Dr. Michelle Haggerty. This has been another great talk.
I love it. Thank you so much for having me.
Yes. Looking forward to next time. Take care.
Next time. Yes. Take care.
This has been another episode of The Lifestyle MD. Special thank you to Lou Musa for the show theme music, created with Brief Photography, and makeup by Janae for the cover photo. And if you enjoyed this podcast and you haven't already, please subscribe today and share with another woman doctor who may benefit. You may also follow me on Instagram at Angela Lifestyle MD. I am Dr. Angela. Thank you for joining me today.